Roll call, please.
Jackson.
Here.
Berman.
Here.
Teets.
Here.
McGilvray.
Here.
Dwyer is absent with notice. Spiz.
Here.
We have quorum.
Great, thank you. Please join me in the Pledge of Allegiance. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
very much. Next, I'll entertain a motion to approve the minutes from August 1st, 2017. Moved by McGilvray, supported by Jackson. Any questions, comments on the minutes? Seeing none, all in favor indicate by saying aye.
Aye.
Opposed? Great, minutes are approved. I entertain a motion to approve the agenda for today. Moved by Berman, supported by Jackson. Any comments, questions on the agenda? Seeing none, all in favor indicate by saying aye.
Aye.
Opposed? Great. Agenda is approved. Now we'll move on to public comment. I know we have some people here that would like to make public comment.
Good morning.
Good morning.
So last night, I attended the Farmington Hills Council meeting and was reminded about an incident that's been going on for several years, and it involves this kennel in Farmington Hills. About 2 years ago, the information we were getting from a lot of the animal advocates, animal rights advocates, was so distressing that Commissioner Dwyer and I went out together to view this facility. So this facility made me cry. It was so horrifying. The abuse and the neglect that I saw, the odors, the conditions of the dogs was so upsetting that I really just couldn't believe it. And it was 2 terms ago, and I started really working on an ordinance to try to control how many dogs could be in a kennel and the cleanliness factor. But there wasn't the political will for that, and to my shame, I let it go last term. Last night at this council meeting, there was direct testimony or a direct presentation by a young 17-year-old girl who was working at the facility. And the conditions she stated, which I have no reason to believe were not true, were so horrifying that I can no longer be silent about it. Now, the our animal control, and it was repeatedly stated at the council meeting that it's Oakland County's issue. Our animal control has shut this place down. What that means is she has 120 days, and she's been constantly cited over the last 10 years and constantly given a few days to rectify it, and she does temporarily. This is a woman who has 48 dogs. She has them living in her home. Her bed is in the living room, and she's got 3 kennels surrounding her bed. It's illegal to have the dogs in the home, and they're in her basement. She's got cats, she's got birds, she's a hoarder. This woman is a hoarder and definitely needs help. She's 79 years old, and she forgets occasionally to give the animals the medication they need. So anyway, we finally have shut it down. Oakland County has finally shut it down, which means she gets 120 days. So the questions that were raised last night is, so does she get 120 days to continue animal cruelty, which is against the law? And does she get 120 days to move and take those dogs with her? Now, I understand that Corporation Counsel is working out an agreement with this woman, but how long can we sit by as the governmental body that oversees this situation and allow this to continue? That's my public comment. Do you have
Thank you for
anything
your
else to
support.
add?
Yeah, my name is Pam Sordell from Puppy Mill Awareness, and thank you for your support on this. We did bring some photos today. We'd like to share them with you. Karen has some comparison photos from 2013. She's a kennel worker that worked in the facility. We've been working on this since then together to say that the monitoring of Oakland County Animal Control is not working. This is a hoarding situation. You can't tell a hoarder to go get medical attention and to follow through. Like she said, she forgets where the medication is at, and there's just too many dogs for her to manage. So we think that this case, unfortunately, has been mismanaged all this time by Oakland County Animal Control, not the officers, but the directors have been making the decisions. Senior officers have wanted to remove the animals, and they put that in the report. Senior officers have reported that there's cruelty, and they've had an on-site vet, which we requested. We wanted a veterinarian to prove that the conditions are impacting their health. So we do have cruelty, and you'll see in the photos that the conditions are impacting their health as far as ear infections, eye infections, gingivitis, tartar, extreme matting. There's feces and dirt embedded in. It's so tight to their skin. When they do get groomed, it creates sores. It's shocking that this kennel hasn't been shut down primarily just on cruelty alone, because other counties have handled cases just like this by having the police or animal control remove the animals because the conditions are so horrifying. Just the overwhelming smell of ammonia would be a cause for removal because it causes irritations, and it's a sign of unsanitary conditions. So last time we were here in September, she had failed like 5 inspections all in 1 year, and we said, well, how come there's no policy or procedure for handling repeat, violations? So now there is some kind of procedure for an appeal process, but it's not public, it's not been approved, and it involves some kind of 4 months to close the kennel. But this doesn't work for hoarders. I mean, we don't want this kennel to go to another county or city. We don't want her to reapply next year. If there's cruelty charges should apply. Even if this is a hoarding case, the only way to protect the animals is to unfortunately prosecute, where you have probation terms that will allow officers to get into the kennel and and to check to see if if she's recollecting animals. And we need restitution because this is going to be costly to the county. It could burden our rescues if these animals need to be treated and housed. 49. This is of last week, 49, including puppies. So we feel that this case has been mismanaged, and we want animal cruelty charges, and we want to set an example that this is how you handle hoarding cases to prevent her from moving to another location and not burden our local rescues with these animals. I did complete a study to see how other cities within Oakland County are handling hoarding. Unfortunately, I only saw one on record with animal control, but they weren't even the primary leading agency. I found 5 on the news and with Oakland County, and our Oakland County Animal Control did not lead one hoarding case. They were only called out to remove animals like dog wardens. We feel that our county should be leading animal cruelty, know how to prosecute, and follow through with, if they receive a ticket, did it fully get prosecuted? Is a bench warrant closed? What's the disposition? They weren't tracking dispositions. And did this person go to another city, and are they recollecting? So local cities are managing their own hoarding cases when our Oakland County should be leading and teaching them how to do restitution, ensuring that they don't recollect animals and not burden our local rescues and threaten to euthanize cats if they don't come and get them. That's not the way our animal control should be managed. I think our officers are doing a great job, but I think that an agreement to give a hoarder 4 months is an impossible task to ask her to get rid of the animals on her own. The animals should have been removed a long time ago. They should have been removed on June 1st, and we want them to be removed immediately. And I hope those pictures show how horrible this really is.
So I'd like to thank you for listening. Anybody that wants to lend support, I will be calling Corporation Counsel because I understand they're writing the contract, and I will be engaged with Mr. Newman as much as possible. I understand this is not the forum to have that conversation with him, but rest assured that Farmington Hills Council was horrified, and they kept saying, well, you got a commissioner sitting right in the audience, and that was me. And I was charged with, this is not acceptable, we're ashamed of it, the Farmington Hills Council, very anxious for us to get involved. So to me, 4 months is not reasonable. I understand it was a legal agreement that was made, but 2 years ago when I was there, she forbid me to come back on the property. And I thought, oh, really? You're telling me what to do now? And she was. And she's somehow or another controlling this whole scenario, and it has got to stop. These dogs are definitely in danger. So, thank you.
Thank you. Anybody else for public comment? Seeing none, we'll move on to the regular agenda. The first item we have up is Public Services Department, Animal Shelter and Pet Adoption Center, acceptance of donation. Joni O'Toole. Moved by Berman, supported by McGilvray.
Good morning.
I'm here this morning to get your permission to accept this donation that was given to the shelter from Alexander Bazinko. He willed it to us. That's $25,000 to go for the care of the animals at the shelter.
Any questions for Joni? Seeing none, roll call please.
Jackson?
Yes.
Berman?
Yes.
Teets?
Yes.
McGilvray?
Yes.
Spiz?
Yes.
Motion carries.
Thank you very much. Number 2, we have Sheriff's Office, Medication Assisted Treatment Program, interlocal agreement with the Oakland Community Health Network and reimbursement for inmate casework specialist position working on MAT program and Jail Alliance with support. Moved by Teets, supported by Jackson, and we have H. Snarry.
Good morning, Mr. Chairman and members of the committee. We're here to answer questions about our partnership with the Community Health Network and concerning the MAT program and them funding a position, inmate caseworker.
Okay, do we have any questions? Commissioner Jackson.
This is the program that really addresses the women's needs in the jail, or could you describe the MAT program a little bit for us and our audience today?
Yes, ma'am. It's designed for both males and females who are incarcerated, so we're not really designating. The only really filters that we have currently in place, and that's done by the funding sources, participants must be Oakland County residents. That's nothing from the Sheriff's Office, that's from Oakland County Health Network, and their funding sources require that kind of condition.
Okay, so other than them just having to be an Oakland County resident, what does the program consist of, just briefly?
Yes, ma'am. The program looks to identify, as we already have been doing for the last year and a half, the opiate addicted inmates who are coming through the back door of our jail, who are going through a detox protocol through Correct Care Solutions. We are identifying what substances they are using, and those that have been involved in a methadone treatment or some kind of opiate cessation program would be screened by Oakland County Health Network for possible inclusion into a MAT protocol. MAT protocol is a medication-assisted treatment where a doctor from one of the licensed facilities in Oakland County will come, perform an assessment, prescribe a regimen of medications, predominantly methadone, Suboxone, or Vivitrol, and start that programming as it relates to the medication. Concurrent with the medication treatment, we're also importing services of a peer recovery coach, somebody coming in to do the individual services as well as group services. To be in the MAT protocol, you would have to fulfill all those requirements. So you can't just say, well, I'll take the medication but not do the group work or the individual work. You'll have to do all the requirements to be a full participant and continued participant in the program. It's a pilot program. We're limiting to 26 participants for this first year, just to try and get a grasp on what it looks like, how we can implement it. There are numerous challenges, mostly time related, because from the time that they book to the time we start the medication is critical in terms of making this treatment effective. So we wanted to start in a kind of a pilot kind of method, so we would get a good foundation built upon if we did further expansion on how that timeline and other challenges might be best and most efficiently met.
Thank you.
Yes, ma'am.
Any other questions? Seeing none, roll call please.
Berman?
Yes.
Teets?
Yes.
McGilvray?
Yes.
Jackson?
Yes.
Spiz?
Yes.
Motion carries.
Thank you very much.
Thank you.
Next, we have Department of Public Services Medical Examiner's Office agreement with Arcturus Healthcare PLC. Hope I said that correctly. And Cass, you're Erica?
Myarka.
Myarka.
Good morning, thank you.
Good morning. Before you start, though, moved by McGover, supported by Berman.
Good morning. We were, the Oakland County Medical Examiner's Office was approached by Arcturus Healthcare, who is representing Avid Pharmaceuticals, who is conducting research on Alzheimer's disease. And part of that research is through brain. And what the Arcturus Healthcare is requesting is the Oakland County Medical Examiners conduct a cranial autopsy and for that study. Now, there's only 200 patients that have signed up for the study. They're terminally ill patients, and the study is only doing 60 autopsies. So we really don't know how many that will actually come through the Oakland County Medical Examiner's Office. So it could be 2, it could be 5. There's no way to determine that, because once they reach the 60, they're stopping the study. So the study for us, on part of that study, is just to do the autopsies and for the brain, and then move forward from there. We do have a confidentiality agreement. We're not allowed to talk about how they're conducting the studies, just that we're doing the autopsies. They've made agreement with the Oakland County Medical Examiners in Oakland County to reimburse us for the expenses based upon our current fee schedule.
Any questions on this one? I do have one.
Okay.
You said we're just doing the autopsy, so we're not getting any type of information back? Or
Now,
we're just-
not right now. They said after 2 years, they would be able to release information, but the information wouldn't come back to us immediately. There's a 2-year window in which they're conducting their studies.
So are they doing 60 over this entire 2 years, or are they doing 60 this year and 60 next year?
No, they're doing 60 total. There's 200 patients that have signed up, and once they reach the 60 autopsies, they're stopping, and they're conducting their research off of those 60 brains.
All right, any other questions? Seeing none, roll call, please.
Teets,
Yes.
McGilvray,
Yes.
Jackson.
Yes.
Berman.
Yes.
Spiz.
Yes.
Motion carries.
Great, thank you very much.
Thank you.
Next, we have communications, which we have none in front of us. Any other business to come before us? Announcements, anything? Seeing none, I'll call us adjourned at